Flurazepam is a long-acting benzodiazepine with a rapid onset of action that is commonly used to treat insomnia. In this video, let's found. What is flurazepam? What is flurazepam used for? Contraindication. What are the side effects of taking flurazepam? How does flurazepam work? How to use flurazepam? What is flurazepam? Flurazepam is a drug which is a benzodiazepine derivative. It possesses anxiolytic, anticonvulsant, hypnotic, sedative and skeletal muscle relaxant properties. It produces a metabolite with a long half-life, which may stay in the bloodstream for days. Flurazepam, developed by Roche Pharmaceuticals, was one of the first benzo-hypnotics, sleeping pills, to be marketed. What is flurazepam used for? For short-term and intermittent use in patients with recurring insomnia and poor sleeping habits. Contraindication. Flurazepam hydrochloride capsules are contraindicated in patients with known hypersensitivity to flurazepam or other benzodiazepines. Rare cases of angioedema involving the tongue, glottis, or larynx have been reported in patients after taking the first or subsequent doses of flurazepam. Side effects. The most common adverse effects are dizziness, drowsiness, lightheadedness, and ataxia. Flurazepam has abuse potential and should never be used with alcoholic beverages or any other substance that can cause drowsiness. Pharmacodynamic. Flurazepam, a benzodiazepine derivative, is a hypnotic agent which does not appear to decrease dream time as measured by rapid eye movements, REM. Furthermore, it decreases sleep latency and number of awakenings for a consequent increase in total sleep time. Mechanism of action. Flurazepam binds to an allosteric site on GABA receptors. Binding potentiates the action of GABA on GABA receptors by opening the chloride channel within the receptor, causing chloride influx and hyperpolarization. Half-life. The mean apparent half-life of flurazepam is 2.3 hours. The half-life of elimination of N1-alkyl flurazepam ranged from 47 to 100 hours. Dose. Insomnia. 15 to 30 mg POQHS. Safety advice. There are also several benzodiazepine medications that currently have a Category X rating. This means that the risk involved with their use clearly outweigh the potential benefits and they are contraindicated during pregnancy. These drugs include flurazepam, Dalmane. That's all the information about flurazepam we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.